The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, welcome to Aging Horizons. We have another great show today. We have a retired individual from AARP, and we'll be talking about age-friendly communities. We'll define what it is and how being age-friendly is also friendly to all other ages. This builds up a better community for all ages so you have more fun, you can live longer, and you can have a better time, so stay tuned.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
I'm Attorney General Tim Fox. Nowadays, all of you have to worry about cybersecurity. Something as simple as visiting pirate websites can put your computer at risk. Hackers use pirate websites to infect your computer and steal your ID and financial information, or even take over your computer camera without you knowing it. Don't let hackers into your house. Be careful with the websites you visit and warn your kids on how to stay safe online. To learn more, visit my website.
Hi folks, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore, and we're coming to you from the 51st Annual Governor's Conference on Aging down here in Billings. And they're fortunate to draw in wonderful speakers and presenters from all over the nation and locally. And with me today is Don Redfoot. You're a former AARP national policy person, and you presented here today at the Governor's Conference on Aging, and you mentioned about age-friendly communities. Could you define that for us and why it's important?
Yeah, well, there are several things to be said about age-friendly. First, in general, what we mean by age-friendliness is really livable communities for people of all ages. Communities that engage their residents and meet their needs at whatever stage of life they are. But of course, those communities that actively engage older residents and enable them to live independently. What it also, though, I want to know, it is a very specific kind of program as well. One that was initiated in the mid-2007 with the World Health Organization, and is administered in the United States by AARP. There are now over 403 communities in the United States that have gone through the process of being designated age-friendly, and 4 states. In Montana, however, there are only 2, and those are Bozeman and Carbon County, where I now live. And that program requires going through a fairly intensive planning program, a program where you demonstrate a commitment by the local leaders to being a place that is age-friendly. And there's a whole set of criteria that are related to that.
To do that, to get that certification.
Yeah.
Now, how does the community look differently after they are a age-friendly community?
Well, hopefully you see real life change. And in Carbon County, we were just designated last year, and it was on the basis of having a 2-year process where we had done a deep dive on the needs that the older population had identified to us, especially in the area of transportation. The immediate effect of that was that we applied to the Department of Transportation for a grant that they gave us to bring in a consulting firm that put together a detailed 5-year plan for us. And we're in the process now of trying to implement that plan. So you may see more change in a year or two in terms of bus systems that operate throughout Carbon County to enable older people to get to where they need to go.
I imagine it goes well beyond transportation. I mean, there's so many needs for seniors. I know socialization is very important. How do you address that?
Well, certainly. Well, as I mentioned, there are 8 different functional areas that are evaluated for age friendliness. Transportation is one of them, but social participation is another, as you noted. And that is something that hopefully emerges more organically in a community. The best social participation is when people are themselves actively engaged. But communities can also do things that enable more participation. One example I cited for Carbon County is every year the Red Lodge Area Community Foundation has what they call a fun run. And what that does is it's a fundraising effort for over 60 different not-for-profit organizations in the county. But it's a way of also featuring those organizations and what they do and enabling people to get connected with something that reflects their interests, whether that's recreational or educational or volunteering for mentoring or various other types of activities. So it's a way that we try to foster that kind of volunteerism and engagement.
Yeah, now I cut a little bit of your presentation and you had wonderful statistics. Could you give us a few statistics about what aging is in our communities and the needs of those individuals?
Well, a lot of the statistics that I cited were from research that looks at what happens when communities don't work for individuals. What happens to people who find themselves socially isolated and lonely? The consequences are dramatic when you look at it. We all need communities in order to be healthy individuals, and it affects us physically as well as emotionally. Probably one of the most impressive statistics I have seen was that an AARP research project on loneliness found that the impact of loneliness, the risk factors for mortality among those who are lonely, is akin to smoking 15 cigarettes a day. That risk exceeds the risks associated with obesity or inactivity or hypertension, some things that your doctor is more likely to talk to you about, and ignoring one of the biggest health risk factors, which is loneliness. And so it impacts on physical health, on mental health issues, and loneliness is a very serious issue in this country. And indeed, it's an economic issue. They also found that the costs of loneliness to Medicare are roughly $1,600 per year per person. That's akin to the costs associated with conditions like arthritis and hypertension.
Wow, that's fascinating. Well, unfortunately, we're drawn to a quick close on this segment. But in the next segment, we'll be talking more about loneliness, how it affects the individual and the community and the taxpayer. But we'll also want you to think about maybe could you start a age-friendly community in your hometown? As this spreads, as the information gets out, this might be the thing that you want to live in, that type of a community, because as we support the seniors, we support all the other age groups. Stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Questions about Medicare and other types of insurance? Contact the State Health Insurance Assistance Program office to get answers to questions like, what is the difference between Medicare and Medicaid? And how do you decide if you need Medicare supplemental insurance? This insurance counseling program is not a sales program. It is available to provide answers to your insurance questions. For more information, call the State Health Insurance Assistance Program office at 1-800-332-2272.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm. Hi folks, and welcome back to Aging Horizons. I'm your host, Brian Lamore. And as we left the last segment, I mentioned about how you could maybe be interested in starting an age-friendly community because it would benefit you, your parents, your grandparents, and the whole community. So Don, how would one start an age-friendly community? What are some of the considerations that an individual would have?
Well, first off, I would hope that it would be more than an individual effort.
Yes.
That there's an organizational basis there. In the case of Carbon County, the Red Lodge Area Community Foundation provided that kind of leadership, that kind of base to go through this process that we went through. The AARP state office here would have toolkits that are available that go through the specifics of what kinds of things they're looking for. It is an application process to be so designated, and it has specific things that they're looking for. And the things that they want to see happen is a detailed evaluation of your community, a kind of look at, they have 8 different domains that they look at. Things like transportation, things like social participation, things like housing, and things like the physical environment. How well do you do with your outdoor spaces as well as the accessible buildings? Those kinds of things, ways to engage people socially, ways that the physical environment also engages people and enables them to live independently. But it also then asks for a commitment by the local leadership of the community, because in order to make these things happen, you need an engaged community, and you need the engagement of the political leadership, the business community, other organizations, senior organizations, bringing everybody together. And that's really what this whole process is designed to do. It's not something that is an award for being some kind of an outstanding aging-friendly community. It is a designation for those communities that are serious about addressing these issues and knowing that they have issues and coming up with action plans for that. And so it is something that small communities can do as well as more urban areas. It doesn't require a large population base, but it does require that kind of commitment and that kind of engagement from the various parts of the community.
Yeah, well, now this is through AARP, and what I hear you saying is that first you do an assessment of your community, and then you enact change by getting partnerships and community support. Sure. And like in Carbon County, once you did the assessment, how difficult was it to get the buy-in from the community to move forward with this?
Well, of course, buy-in is always a relative thing.
Yeah.
And so the question is, certainly there has been a lot of interest and the expressed support from our county commissioners, for example. Yeah. And they have made suggestions to us for ways that we could implement parts of this age-friendly initiative. What's probably a tougher nut to crack is translating that level of support from letters of support to actual funds for various purposes and dollars. We're working on that, and I know that's an issue in many communities. But you start, though, by getting the interest level, and you get the engagement, and demonstrate the level of commitment from all these sectors, as I say, the business community, the senior community, the educational community, the other communities that are engaged in this process. And if you have that level of commitment, then you get the other things going, the ball rolling on other things. And everything doesn't require money either. Sometimes it's just a matter of getting the faith communities engaged in doing some things and just reminding them that there's a population out there that needs some engagement.
Some engagement and address it so they can have a better senior population. Well, now you were with AARP. You've been retired a little bit, national, so you know a lot of the workings of AARP. For someone who's saying, I'd like to bring this into my community, what kind of support do they get from AARP? I mean, you know, AARP requests an assessment, but do they just kind of hand you a pamphlet and say, address these things and get back with me?
Well, no. In fact, the AARP state staff has been very good about being engaged, and they're willing to come out in most cases and meet with you, talk about the process, talk about what other communities have done, because it's not a cookie cutter, this is what you have to do, A, B, and C. Right. It is, what have you identified as your unique needs in your community, and what is it that you feel that you're able to take on at this point? Because we can't do it all, obviously. Right. But it's really more of an indication of that active commitment, engagement on the issues.
And they'll work with you to help
They'll work with you.
But like, I imagine, you know, one individual is like, oh, are we going to support Brian Lamore doing this? They probably want an organization or a group of people to work towards this, right? Yeah.
And in the case, as I mentioned, with Carbon County, we had a ready-made kind of community foundation. The other age-friendly community in Montana is Bozeman. And there it was much more of an ad hoc effort by a group of people. So it can differ from community to community who steps up to the plate on it and takes the leadership.
And how do you address the community's needs?
But what I do know, I was reminded after my presentation this morning that there are over 70 such community foundations throughout Montana. And so that's at least one possible forum for such a process.
Okay. Well, I think what's important to point out here is that through AARP, they want to develop more community, age-friendly communities, and they're willing to help you out. You can contact the Montana AARP in Helena at the number on the screen, and they could help you and your organization to get the ball rolling for your community. Stay tuned. We'll be right back with so much more.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
If you give or receive care, you already know that it can cause stress on caregiver and receiver alike. The good news is, if you have limited resources, help is available. The Montana Lifespan Respite Program may be able to help you pay for care while you take a break. Even better news is how easy it is to apply. You can get an application online or have one sent to you. We'll get back to you within 5 working days. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about age-friendly communities and how you can develop that in your communities. Joining us is Dawn Redfoot, a retired AARP national member. And Dawn, when we left, we were talking about loneliness, and through a lot of our Area Agency on Aging, Older American DAC programs, we try to address that. But it's a real big problem, particularly the eastern part of the state versus the western, right?
Sure. Well, yes, those programs are important. But one of the things that we have done throughout Carbon County is work with our local senior centers that are often receive funds for the meals that they operate and so forth from the area agencies on aging. And yet there are real challenges, as you noted, that differ by region and location in the state. One of the things I noted was the exodus of the younger population, particularly from our northern and eastern counties. Between 2000 and 2010, those counties lost a quarter of the population age 18 to 29. These are young people who had to go elsewhere to find employment and therefore are not establishing careers and families, and that has a real impact on communities. That has a real impact on the social isolation of those who remain behind. At the time, the average farmer which farm economy, of course, is important in those northern and eastern counties. The average age, though, of the owners of farm is 58. And without another generation coming along, you find increasing amounts of physical isolation and social isolation across generations. So it's not just a matter of, as I said, the physical, but it's also that generational aspect where we're seeing an impact on closing schools and so forth that reflects the changes in the population. Now we see a very different picture in the southern and western counties, especially those urban areas that have education centers like Bozeman or Missoula, or Billings, which is a commercial center, and where there are employment opportunities, and they're seeing net increases in population. But it is, each of those then creates very different challenges, and it's one of the reasons why this age-friendly initiative is not a cookie-cutter thing. It is really something that each community has to address the unique challenges, the unique configuration of population issues, as well as resource issues. But every county can be doing something.
Yeah. And you know, on TV today, they mentioned that Bozeman is getting 10 new people a day locating in Bozeman. So the population is increasing. I imagine a lot of the people who are migrating in are generally the younger people. But how do we communicate better? How do we address the issue of loneliness with seniors? I mean, now we have social media.
Sure.
And how's that working? Is that a good thing for seniors? Or?
Well, the research on that is very interesting because in general, of course, we have seen a very dramatic increase in the use of smartphones and social media, and it is a way of engaging. And yet the AARP research on loneliness found very interesting results. Those who were not lonely found that those social media and those new technologies were important additional ways of connecting to other people, connecting with family who were more remote. Those who were lonely, on the other hand, were more likely to note negative effects of technology, that being engaged with through social media was a barrier to deep relationships, that they missed those the more personal relationships. And so it's a mixed blessing. Even with the increase, the dramatic increase in the use of such technologies, we have not seen a corresponding dramatic decrease in loneliness. And so for all the connectedness, all the means of communication, we still have people who are experiencing loneliness and all the effects that go with it.
Well, now with the age-friendly communities, we're talking about loneliness, but what about an individual? What can they do to help dispel loneliness?
Well, it is a matter, obvious, in many cases, of just reaching out, being a good neighbor. It seems it should go without saying, but indeed, one of the findings of this research was those who knew their neighbors were just less lonely. Well, that seems obvious enough, and yet there are too many people who no longer know their neighbors, no longer, or if they know them, don't have the kind of relationship where they could call on that neighbor and trust that neighbor to help in a time of need. And so, interestingly enough, though we talked about the rural areas and the problems, rural people express less loneliness than urban. And so it's not a matter of having more people around or more neighbors, it's the kind of relationships that you have. And so sometimes it's just reaching out to that person, especially the person that you rarely see come out the door. They may be the one who needs your help most.
Well, I remember in another venue someone said we need eye-to-eye contact with our friends. The telephone's fine, but nothing replaces eye-to-eye.
Well, it doesn't. And that human touch, that interpersonal, direct communication, all these other tools are helpful, mind you, and they're useful. And but there's nothing that replaces the real person.
person to person together. Exactly. Well, unfortunately, we're drawn to a close on our third segment. I'd like to thank you for being on the show. I appreciate it, and I loved your presentation with statistics. And for our viewers, age-friendly communities, it's done through AARP. You can get the ball rolling by contacting them. They'll give you support. They'll give you the program. But a lot is up to you and your organization to make it effective in your community. And an age-friendly community, for seniors, is friendly for everybody else too. There's a few considerations they need, but you can address it. For Aging Horizons, thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.